Hello, I'm Steve Jameson. I'm working for One Deep Breath on behalf of NHS Islington, who are actually running this project on behalf of the Stop Smoking Service. We're here today to reach out to the Somali community, in particular in Islington, and we're here in the Andover Estate running a Somali health awareness day. We're going to cover all these different issues: stop smoking, respiratory issues, childhood immunisation, dentistry, diet, self-guard and safeguarding children. The reason why we're promoting this event before Ramadan is that we're looking to try and help people who might want to stop smoking during Ramadan, and we're going to set up a stop smoking group here in the Andover Centre every Tuesday from the 3rd of August running through till 14th of September around lunchtime, where people can come in, have a chat about their smoking behaviour. We're going to talk about cat, we're going to talk about shisha, and effectively see if anyone that does want to quit, see if we can support them through a quit, and we can help them. Once a week we'll sit down with them for 10 minutes, give them a carbon monoxide test which measures their lungs and all the amount of carbon monoxide in their blood, and we can also give them advice on nicotine replacement therapy like patches and gum and inhalators, as well as tips, to help deal with cravings, like drinking lots of water and getting more exercise, and help them try and stop smoking over the next sort of 7 weeks. And that's what we're here today to do. We're recruiting as many Somalis today as we can to try and reach out to them, people that wouldn't necessarily usually access the NHS Stop Smoking Service. And we're here, we've got lunch this afternoon, and we've got lots of people offering advice on different health issues.
My name is Abu Kawale. I'm a community engagement officer in Copeland College, which is based in Brent. I'm also a member of London Somali Youth Forum. Now, first and foremost, people don't know about what's cat. So cat is a drug, it's a green leaves, and which comes from East Africa, and one has to know also this drug is illegal in America. It's class A drug in America and most of European countries. It's legal here. You can actually buy 3 bantu by a bunch, and the effect of it, from my experience as an ex-addict who used to live in the streets, I can tell you cat is the biggest barrier of Somali community towards integration and being part of society. And there is a lot of domestic violence, and the children are suffering. It's breaking down the families. And medically, there is a lot of liver diseases, a lot of clear evidence of mental health, and there are a lot of paranoid and so on and so forth. One thing which we have been highlighting during the last 6 years is to campaign and tell the government, in line with the other European countries, this drug should be banned. The message to the community is, unless you come forward and tell the professionals and what your issues are, they are not in a better place where they can assist you or provide you with help. So Somali community needs to get together and highlight all these issues and be open about it. I mean, there's nothing to be shy. And unless we do that, unfortunately, our children are already failing from the schools. Not all of them, majority of them, and it's to do with absent fathers and a lack of support at home. And it's the level of divorces and breakdown families is increasing. Our young people are again finding themselves on the wrong side of the law. I work with the youth team, which is youth offending team, and I see day in, day out, almost every week, a young Somalian boy who's finding himself on the wrong side of the law. Again, this is something we need to come forward and try to find help and resource. And the most important thing is you should come forward, and if you believe this drug should be banned in line with other European communities, go to London Somali Youth Forum, sign in the petition. Over 72,000 has been signed, and I think it's a discrimination for the British government not to act and not to ban this drug.
I'm Robert Lowton from NHS Islington Stop Smoking Service, and today we're doing our Somali Health Awareness Day, mainly because we feel that there's a lot of smoking in the Somali community, and we don't see many Somali people in our clinics or community coming to our surgeries for help. And obviously, we want to help people stop smoking, and especially people who are smoking and not getting support to stop, because it's much harder to stop without support from a service like ourselves, for instance. So the main reasons that it's a big issue is that people aren't aware that smoking is the biggest killer in the world, and it's certainly the biggest killer in the UK of any disease or activity. It's about 100,000 people every year die from just their smoking habits. So that's about, if you think of it per day, that's about 13 people every day. And in Islington, our smoking rates are much higher than the national average. So we've got a very specific problem. And we also know that in our Bangladeshi and Somali communities, smoking is even higher than our Islington prevalence. So we're very concerned about this part of our community, smoking and being unwell, and not getting services to help them. So what we're trying to do today is bring a whole lot of health activities together, and so that the Somali community can access them. We've also got lots of different resources we've created, including especially how to stop smoking and improve your health and improve your life in Somali, which we had translated specially. The picture's not very good, I apologise for the blurry picture, but the text is all very good, very useful, and talks you through the whole process about why smoking is harmful, how stopping will benefit everybody, and also talks about the products to help people stop, because a lot of our Somali clients don't really like to use products to help them stop, and in our experience it can really help. But obviously you don't have to use them, but they're there if people choose to. So we just really want to highlight that there's a proper service out there to help people, and that we can be accessible. One other thing we're doing today, we're trying to recruit volunteers from the community who speak Somali languages, come and train as an advisor, and then help us to help other people to stop smoking. So we'll be doing that training in the next few days, and we're hoping that from that we'll then have a team of people in our community who just talk to their associates and their friends and their relatives, let them know about why smoking is so bad and how they can go around getting support to stop. And then we'll be mentoring those advisors and seeing how they get on and what the results are. So we're really hoping that we can reach this part of our community that hasn't really been coming to our service and really improve their health.
My name is Mr. Abdullah Aiden, and I come here to take an advantage for the health awareness here, and that's why I came here today.
It's a genetic disorder. It is not I don't want to do it.
And I'm from NHS Islington. A lot of you know me already. I'm really pleased that we've got a good turnout of attendees and also exhibitors, which is great. Hopefully everyone can find out the information that they need to get, that they want to get today. Just, if you're not clear who's here already, I'll just go through it. We've got myself from the Stop Smoking Service. Obviously that's the most important person of the day. So as well as getting information about smoking and stopping smoking, you can also sign up today to become a trained advisor if you want to as well, so you can help other people in your community to stop smoking, and that's something we're really keen to do between ourselves and Emily and Steve. And you can sign up with any of us if you want to do that. So as well as me and the important smoking issue, we've got representatives who can help you with respiratory and dietary issues, questions about dentistry, our friends at the Manor Gardens Welfare Trust, and they've got many health projects going on that they can talk to you about. And later on we should have Andrew from the London Fire Department as well. I think he's on his way a bit later, isn't he? Yeah, which will be great. He's a very interesting guy. But the point about today is it's for your benefit in the community, so we really want you to ask any questions you want to and get any information out of us that you want to get. So please don't be shy or afraid of us. We're not really scary, most of us. We are going to be having lunch soon, so we haven't served it yet just to keep you here. So before we do that, we're not so silly, we know. So before we have lunch, I'd like to introduce you to Abuka Awali, and he's our guest speaker, and he's going to talk to us about cat use, which is a really, really important issue for our Somali communities. So before Abuka comes up, I'd just like to say thank you very much for coming, and I'll hand over to Abuka.
And I'm sure many of you haven't seen or heard of the card, so I'm going to leave this one to go around to have a look what the card is all about. Now, first and foremost, what is card? And the word card comes from Somali language. In the Somali dictionary, the card means to grab something and take control of it. And from experience, I can say hand on heart, that's exactly what it does to the human being. And it's a Class A drug in America. It's banned all over Europe except the UK and Netherlands. That should also tell you. And the World Health Organization came together in 1989 and recognized card is not fit for humans, and it's a drug. And from personal experience, I came here, this country, in 1997, young man, fairly young, who had a big dream, who wants to learn and integrate and earn and be someone. And I also had a moral obligation to me and to my family, who was back home in Somalia, to help them and support them. And unfortunately, the dream did not happen the way I planned. I came to this country, and I was coming from the Civil War background. I was not quite stable, and I was all over the place seeking for help and where to start. Different environment, different language, and London, who is one of the fastest moving cities in the world. And I really didn't know where to start. So what I did was, I thought I'm going to seek advice. Unfortunately, the place I went, it's a place called Marvish, where a lot of young men, or old men, Somali background, are sitting and drinking teas and chewing this drug. My aim was to seek help, and those who were here before me, just to steer them to the right direction. But the advice I was getting was just relax. We all been here. We know you are bit excited to be here, but take it easy. And I was offered a drug for the first time, this drug, and it took months, weeks, years. For the first time, for me, it was a past of, way of passing my time. I became addicted to it. 7 years down the road, I see myself living in the streets of London, electronic tagged, finding myself wrong side of the law. At the same time, I was father of kids. At the same time, of course, I was husband of a beautiful wife. And there was a lot of domestic violence. There was a lot of issues, and I didn't know what year my child was at the time. And there was never parents' evening, and what did you learn today, and good night, and daddy will tell you a story. There was never that. I was absent father. There's an Arabic word actually for it. جسم الحاضر القلب الغايب, present body, but absent mind. I was there, but I was not there. And the turning point came to when I had been stabbed 4 times in a Marvish. Before that, I became very aggressive, paranoid. I lost my self-esteem, my self-confidence. I was thinking at the time, everybody's talking about me, everybody's looking down on me, everybody's, thinking, what is this asylum seeker? We give him a chance to be somebody, and look at him now. That was my own thinking, and even when I go to the public transport, people used to, guys do this, and girls, they hide their handbags and say, God, I don't want to be anywhere near him. And some cases they were true, but some cases it was all in my mind. As I said, turning point came when I had been stabbed 4 times. I ended up in a hospital here in my very close to my liver, very close to my arm. The doctor said I'm very lucky to be alive. If that knife would have gone 1 more inch down, I would have been dead, straight to the liver. And the other one was to the heart. And I'm very proud to say that was the turning point, and since then I have never chewed card. It's been 7 years. I'm a community engagement officer in the Copeland College where I'm based. I'm a youth panel member where I sit down with the young people who are finding same thing, wrong side of the law. My message here, when I got the phone call last night from Sarah who told me you guys are coming here, I thought, you know what? It's highly likely Somali community is not coming forward. So many of them. So I'll grab the opportunity. So the hunter has been hunted now. I'm here to give you information about the community. And I strongly believe, and by taking this on board, so you know what kind of community you're dealing with. taking that on board, so there will be better services and better help available for the communities in Islington. Now, I have been campaigning for the last 7 years, and I personally believe it's a moral obligation for me. I'll be very selfish if I say, you know, I'm all fine, you know, I'm all sorted, my family is stable, you know, I support myself and my family, and I'm going to get on with my life. I cannot do that. I see young people, young men like me, who are failing into the same trap where I was a long time ago. And this is when I come up with this, and it's the campaign, the logo of the campaign. It's basically Lollipop Man and Stop Cut in UK. And I've collected over 72,000 signatures, and I've been pressing government like 7 years. I've met drug ministers, home secretaries, promises. And the one thing I heard from all of them saying, we are aware of the growing concerns of cut. Government is monitoring and scrutinizing, closely following up, and we are considering. And I think, strongly believe, that cut should be banned. The government is saying we are aware, but at the moment it's only affecting a small part of society. It's not expanding problem. To me, that's a clear discrimination, and we should be focusing evidence of mental harm and social harm rather than where ethnicity groups are using this drug. And that's not something I'm going to take on you, but what I'd like you to take away from here today is those families. There are signs of neglect with the children. There are signs of domestic violence in those families. There are people who might come forward and seek help, but they are a bit hesitant, and there is a language barrier, and there are sensitive issues which women do not want to talk about. So you guys are in the front on this fight, and by just knowing what kind of environment this mother is coming from 4 children, maybe in some cases 5, 6, by herself, cooking for them, washing for them, taking them to schools. And I tell you one thing, Somali women are the most, what's the word I can use, most hard-working women, most tolerant women I've ever seen. Any other woman will say, get out. Not good enough. If you're not contributing, if you're not raising these kids with me, out. But there are cultural issues. You know, nobody wants to be a single mother, divorcee, struggling with. Although she knows he's not a role model for the kids, he's not contributing to the family. They rather stick with him, and I love them for that, because my wife stood by me, and now she's enjoying the benefit of it. So when those people come for you, to me, I have done my job today. If you can say, oh, I know what's going on. Sit down. Can we talk about what can we do to help? And one other thing you should take on board from hand on heart is community-based solution. Young girls sitting over there, Sahara, people like Abdul Rashid, there are a lot of active people within the community who have been there and done it and want to help. But if you, and I'm not saying you do that, if you say, oh, hard-to-reach groups, we're going to do a few posters, we're going to drop a few leaflets, and hopefully they will all come singing the same song, I'm afraid you could not be wrong. Working with the community is the way forward. And enjoy your lunch. Thank you very much for listening, and have a lovely day.
My name is Sarah Mahmoud. I run Somalian cooperator in Somalian community called Markabli Relief and Development Trust, which is based in 187 Sisters Road. Your question is, Adam Kusu Ashad Kumakdo, a height, why Lukadu I that cool. If you come back to your question. Because, look, I started with Somalians. Magaigo Halira, Sarah Mahmoud. Somali community called Ushkaya Somali Markabli community and relief and development. We're 187 Sister Road, su-aashii ahayd haddaan u noqdo waayo hooyooyinka Soomaalida ayna meelahan oo kale inta yimaadaan luuqadda ay dhib ku qabaan ayna wax su'aalaha ay qabaan ayna u soo jeedin mararka qaarkood waxaa dhacda in hooyooyinka Soomaalida ay dareemayaan inayna halkan imaan karin oo ka hadli karin su'aalaha ay qabaan laakiin waxa uu sheegayaa su'aalaha ay qabaan inay dawladdu ama marba qofkii ama kambanigii soo jeediya ama hadda wax meeshan joogno kale waxa jooga NHS-ka way diyaariyeen interpreter ama dad ku turjumiyo ku fududeynaya su'aalaha qabtay kaaga jawaabaan marka waxaan ku leeyahay ka faa'iideyso imaaw haddii ay tahay caafimaadka cirbadaha carruurta lagu dirayo kaleeto waxyaalahaas oo dhan su'aal aad ka qabto waa inaad timaadaa meeshii si su'aasha ama dhibka aad qabto aadna u soo jeesato lagaana jawaabo weligaana ha isoo malaynayna in luqadaha dadka turjumiyo joogaan waana ku diyaar halkan waxaa maanta halkan lagu qabtay in sigaarka la joojinayo ama baqaadka oo kale waxyaalo badan caafimaadka ku saabsan looga hadlayo marka waxay ahayd jaanis fiican oo Soomaalida ku fiican hooyooyin badan oo Soomaaliya way yimaadeen laakiin waxaan rabaa meelahan oo kale inay ka soo qayb gashaan carruurta cirbadaha lagu daro kale laga hadlayay oo adinku badanaa emarasta dadku yaqaanaan oo adinku badanaa hooyooyinka Soomaalida ay diidaan inay ilmahooda ku daraan waa lagaaga jawaabi lahaa su'aalaha aad qabto cirbadahaas ku saabsan waxaa jiray caafimaadka hilibka badan oo dadka galay jaanis fiican buu ku ahaa hadda hooyooyinka Soomaalida meelahan oo kale aad timaadaan waxayna idinku fiican tahay inaad ka soo qayb gashaan waa lagu sheegayaa waxyaalaha cuntada oo caafimaadka ku jiro oo cunayso hilib badan kugu dareemin waxaa looga hadlayay hooyooyinka guryaha markay dhalaan dadku u yimaado caafimaadka ka socda way joogeen waxay kugu fiicnaan lahayd inaad su'aalaha weydiisato marka guriga lagu yimaado waxyaalaha ka hor yimaado qaladaadka aad la kulanto waa lagaaga jawaabi lahaa oo kaleeto marka waxaan idinku waaninayaa inaad timaadaan meelaha looga hadlayo waxyaalaha idinkeedna aad ku garanayaan